Hello, Diaz here, founder and owner of Greenwood Dental. Welcome back to another episode of a POP series. POP stands for Patient Outreach Program, just in case you guys were wondering where POP came from. Okay, so today it is the season of what? It's the season of allergies and sinus infections and sinus inflammation and head cold. So we are dealing with that condition or this condition these days, starting from I think last month, that we have been seeing a lot of patients coming in with the complaint of sinusitis. Now, the misconception or what's confusing about the sinus infection or sinus inflammation is a lot of you come in with the complaints or chief complaint of my teeth hurt and I think I need a root canal, or my tooth hurts, I think I have an infection. This season, especially with the high pollen allergic season or allergy season, we see a lot of a combination of the sinusitis plus the toothache or the tooth throbbing. It's just a lot of pressure, especially on the upper teeth. Now, what are sinuses? Sinuses are basically the air pockets that in the skull that when we breathe in, it helps us breathe in the air and feed oxygen to that area. Some of us have a certain anatomy that would allow or permits the sinusitis or the sinus inflammation or the sinus infection causes dental or tooth pain or tooth pressure or pressure on the teeth themselves. What that means is some of us have tooth sharing the space with the sinus or so close to the sinus space that any irritation to the sinuses will cause toothache. And the misconception, of course, is my tooth hurts. So when we take an x-ray and we eliminate the possibility of the tooth involvement, then we take a look at the sinuses. Luckily, on the x-rays, we can tell if the sinuses are full or sinuses are airy or empty or relaxed. If the sinuses are full, we will definitely rule in the sinusitis condition, and sometimes is as simple as taking antihistamine or anything over the counter that helps with allergies, and before you know it, the tooth will feel much better. So not every, again, refer to my video that I uploaded about pain, not every mouth pain is tooth pain. Unfortunately, the tooth gets a bad rap as far as pain, and which is fine. We always try to eliminate or rule out the tooth as a source of pain. If, again, we don't see anything wrong with the tooth, then we look at the area around periodontal disease or periodontal abscesses or periodontal inflammation, which is the surrounding structures around the tooth, and or, again, sinuses. So feel free to reach out. We are getting a lot of calls and we're getting a lot of visits from you guys as far as, again, my tooth hurts, but we're finding out there's a lot of sinus challenging these days, considering the weather. The spring is upon us, and this is going to continue all the way through probably June. It will calm down July, August, and starts again in September, October when the fall arrives. So I hope this helps. And I am out of time again. We love you. Be safe, and DS out.